Skincare is just as important in his or her daily routine. In today's edition of Caregiving 101, Starr Calo-oy tells us how caring for your loved one's skin goes a long way. Starr Calo-oy with Caregiving 101 is here, this time with some tips on skincare. And Starr, I have to ask you, this is such a fascinating topic. I would have never thought about skincare.
Yes, it is something that many people they take it for granted. Because what do we do when we're younger? We think about keeping it moisturized, and we think about, you know, maybe sunscreen for the sun, but we don't think of it as being life-threatening if you don't take care of your skin.
Okay, so when it comes to skincare, what are we talking about? We're talking about sores, we're talking about bed sores, we're talking, I mean, there's a whole list of them.
Oh yeah, dry skin, bruising, all types of things. So, for example, let's take just the basics to begin with. What do we think about? All right, we sleep so much of our life, a third of our life, right? And the elderly sleep even more than that. And where do they sleep? They sleep in a bed. If your loved one has a hospital bed at home, check the mattress and make sure that it's not just a permanent, hard plastic cover. If so, then you'll probably need a gel pad mattress that you can ask your doctor to write a prescription for, so your insurance will cover it. Or you might want a flotation mattress, or you can have a egg crate is one of the other mattresses. There's also the air flotation mattresses.
So you want to keep the bed as comfortable as possible.
Oh yeah, and not too hard, not too soft also, and keep all creases out of the sheets that are on the bed, because if they lay on a crease on a sheet too long, it'll develop a sore or it can develop a red area.
Wow, okay, okay.
Mattresses are important.
Right, and so some other tips that you have.
Okay, if your loved one is bed bound, you don't want to leave them without being turned. If they can't turn themselves and move around in the bed, turn them every 2 to 4 hours. Turn them to one side, prop pillows behind their back, in between their legs, up on the side of their head, and then turn them to the back, then turn them back another 2 hours. And I know it seems like a lot of work, Eileen, but gosh, it's so much better than the alternative, which can end up leading to bed sores. Also, if your loved one is stationary in bed like this, then you can go to any of the drugstores and purchase it's called sheepskin protectors for your elbows and for heels. Heels are very thin and they're very delicate. And many times we said put the pillow underneath their legs if they're on their back, so that the leg isn't straight out and on the bed, because that can cause a sore. But under their knee, so that the pressure is relieved off the heel.
Okay. Are there ways to prevent these sores from happening?
Yes, there are. When you give them their bath, okay, check their body. That's a good time to check every nook and cranny of their body. You need to check it all. You need to make sure that if they are heavy, or even if they're not, sometimes they just have extra skin, lift the skin folds up, make sure that they're dry with cornstarch after the bath.
Dry with cornstarch?
Cornstarch is the best thing, not perfume powders, which can lead to allergic reactions.
Okay, so we want to make sure that they're dry, and cornstarch will absorb some of that sweat.
That's right.
Okay.
And if you notice red areas, for example, if your loved one has oxygen and there's catheters, tubing that goes behind the ear, and also the tubing from catheters, if they have a catheter, and they're wearing one for urine, for example, make sure that that tubing is not resting too long on one area. If it is, and it continually gravitates toward that point, we have an excellent tip for that. Get some liquid Band-Aid. Put on 5 coats. Allow each coat to dry around the ear, and that way, because you can try patting and it moves, invariably it falls off, it's bulky, it's uncomfortable. But liquid Band-Aid is a great tip, because then you can protect that area, and you can end up easily getting it off with soap and water when it comes time for their bath next time.
And you also do have some great tips in your books right now, caregiving tips from A to Z, over 1,200 tips, for everything, you name it.
That's right. And skincare is S is for skincare, and we cover everything. Wheelchair pads are very important, and because if they're going to be sitting too long, you might not think that that could be a problem. But just keep in mind that any place that your skin is resting in too long an area or something resting up against it can lead to bed sores. If they do have bed sores right now, please contact your doctor and let them know so that you can begin treatment right away.
Because really, these bed sores can be life-threatening.
They can. In fact, if they're left untreated, it can end up tunneling in. For example, on the tailbone, which is very common, it can end up what they call tunneling in to where the bone is obvious. You can see the bone.
Wow.
And then if that happens, it can lead to a septic episode, and the infection can go into the bloodstream, which can result in death.
Okay, so once again, thank you so much, Starr. Once again, Caregiving 101 tips with Starr and Bob Calo-oy. If you missed it here, you can always tune in to KKYX 680 AM every Saturday morning from 8 AM to 9 AM. They always take your phone calls. You can